Welcome to the deep dive. Looking at the sources you sent, what really jumps out is this puzzle. We see these fantastic ideas, things that seem like they should change the world, but some catch on fast and others just stall. It
Yeah.
really makes you think about what's going on under the surface.
Right.
What makes one idea spread and another one fizzle out. That's really what we want to unpack today.
Absolutely. It's a great set of materials for digging into this idea, the diffusion of innovations. Everett Rogers really laid the groundwork here, didn't he?
He sure did. His book is still kind of the benchmark.
It is, and it gives us such a useful lens, especially for tricky areas like healthcare, where new ideas sometimes struggle to take hold.
Right, and we should be clear, we're not just talking about people knowing something exists. Diffusion is more social, isn't it?
Exactly. It's about how a new idea gets communicated through social channels over time and then actually gets adopted by people in a system.
It's that jump from, oh, interesting, to, okay, I'm actually going to do this.
Precisely. And the fascinating thing, sometimes the frustrating thing, is that even really beneficial innovations can take a surprisingly long time to spread. Your sources gave some great examples.
They really did.
Yeah.
Like Project Echo, starting way back in 2003.
Mm-hmm.
Smart idea in New Mexico, connecting specialists with rural primary care docs. Great for things like Hep C initially, then others.
Yeah, expanding access to that specialized knowledge.
But even by, late 2017, it was in about 160 U.S. sites, maybe 60 more internationally, which is good.
But maybe not as widespread as you'd expect, given how long it had been around and the potential need.
Exactly. And then there's the greenhouse model for nursing homes.
Oh, yeah, that's another interesting.
Trying to make them more like actual homes, giving residents more control, empowering the staff. Started around the same time, 2003.
Right, with foundation funding. And again, positive impact, clearly.
By 2017, over 200 sites, aiming for 300. But the point the article made was,
That neither had really hit that national takeoff point.
right, when you think there are thousands of rural clinics, thousands of nursing homes, it just highlights the challenge. Why is it so hard for good ideas to scale sometimes?
That's the core question, isn't it? And it often follows this pattern, this S-shaped curve.
Ah, yeah, the S-curve, slow start.
Slow start, yeah, just a few people trying it out, then whoosh, rapid acceleration as it catches on.
And finally, it levels off as pretty much everyone who's going to adopt has adopted.
Exactly. Though your sources did note that sometimes policy diffusion can be faster, if there's a big national push or money involved.
So that initial slow phase isn't always a bad sign.
Not necessarily. It's often just the way it works. The key is understanding who those early folks are and how they influence the acceleration later on.
But it's not just about the one innovation in isolation, is it? The sources mentioned other factors.
Oh, absolutely. Innovations rarely exist in a vacuum.
Yeah.
There are always competing ideas, maybe things that work alongside the new idea. People have choices.
And let's be honest, most new ideas don't actually make it big.
That's a crucial point. Failure is actually the norm in diffusion. Success is the exception.
And we also need to think about letting go of the old way.
Right, deceleration. Adopting something new often means ditching something familiar, and that's hard. Plus, if respected people decide against something, that sends a strong signal too. Social rejection is powerful.
Which brings us to these opinion leaders. They seem critical, especially when adoption is voluntary.
Hugely important. If the people others trust and look up to adopt an innovation and talk about it positively, that can really fuel the fire.
But if they don't,
Then it can stall. The whole system might not shift. It really underlines that diffusion isn't automatic. It often needs those champions.
And this process has real societal consequences, doesn't it? Good and potentially bad.
Definitely. When diffusion works well, it means better knowledge, better access to services, but it can also widen gaps.
How so?
Well, often it's the communities or organizations with more resources, maybe more connections, that adopt first. So they get the benefits earlier, potentially leaving others further behind, at least for a while.
Like that example about Medicare wellness visits being less adopted in practices serving poorer areas.
Exactly. It highlights how diffusion, even of beneficial things, can sometimes worsen inequality if we're not careful.
Okay, so let's break it down. What are the key things that influence whether an innovation actually spreads? The sources pointed to a few main areas.
Yeah, fundamentally, it comes down to three things. First, the innovation itself. What are its pros and cons?
Okay.
Second, the potential adopters. Who are they? How are they influenced by others, by social networks?
Right.
And third, the bigger picture, the social, political, maybe economic context it's all happening in.
Let's start with the innovation itself. What makes one idea more appealing than another?
Well, cost is always a big one. And that's not just dollars and cents.
But time, effort, resources too.
Exactly. Then, effectiveness. Does it actually work better than what people are doing now? Or at least, is it perceived to be better?
Perception matters. Okay.
Simplicity is huge. Is it easy to understand? Easy to use.
Makes sense. People avoid complexity.
Compatibility, does it fit with existing ways of doing things? With people's values? With the tech they already have?
Yeah.
Observability, can you actually see the results? Are the benefits visible?
That seems important for convincing others.
Definitely. And finally, trialability. Can you try it out first, maybe on a small scale, or adopt it piece by piece? That lowers the risk.
Okay, those all seem like pretty practical considerations. It's like we're all doing this kind of cost-benefit check in our heads.
We are, consciously or not, and if an innovation passes that initial check, that's when the secondary search often kicks in, as your sources called it.
What's that about? Seeking more info.
Yeah, basically. People start looking for validation from others they trust. Those opinion leaders again.
Ah, okay. So they're checking, what do the experts or my respected peers think about this?
Exactly. It's about reducing uncertainty, making sure you're not going out on a limb alone. And it's not always purely logical. Sometimes it's about status or wanting to seem innovative. It's navigating that hesitation we all feel with new things.
Got it. Now, this idea of innovativeness and the different types of adopters, that was really interesting.
Yeah, Rogers categories, they're very helpful. You start with the innovators.
The real risk takers.
Pretty much. They love new stuff just because it's new. They're not worried about fitting in. Then you get the early adopters.
They're influential.
Very. They look carefully at the advantages. They're respected. And they often become those crucial opinion leaders.
Okay. Then the majorities.
Right. The early majority and the late majority. These folks adopt more when they see others doing it. Social pressure becomes a bigger factor. They don't want to be left behind.
And finally,
The laggards. They're often pretty skeptical of change, maybe more isolated, and tend to adopt only when it feels almost necessary.
understanding these different groups seems crucial if you're trying to promote something new.
Absolutely. You tailor your message. You talk about hard data and advantages with early adopters, but maybe focus more on peer success and ease of use for the late majority.
And where someone sits in their social network matters too, like who they ask for advice.
Definitely. Your position in those advice networks is a pretty good predictor of when you'll adopt. Often, things start bubbling up on the edges of the network and then move inwards as the central, highly respected people get on board.
And we tend to listen more to people like us, right? This homophily idea.
That's a very powerful force. We trust people with similar jobs, similar backgrounds, similar beliefs. If they're adopting something, it feels safer, more relevant for us.
Makes sense.
And interestingly, the sources mentioned how delayed rollouts in different places can actually help later adopters. They can learn from the early experiences elsewhere.
Like watching someone else test the waters first.
Exactly. Think about your own work.
Yeah.
You probably pay more attention to a recommendation from a direct colleague facing the same issues than someone totally outside your area.
Yeah, definitely. Okay, let's clarify something. Dissemination versus diffusion. They sound similar, but aren't the same.
Good point. They often get mixed up. Dissemination is the active spreading of information. It's usually deliberate, maybe one-to-many, like presentations, marketing, setting up branches.
So pushing the information out there.
Right. But diffusion is the social process of uptakes that might follow. It's about whether people actually start adopting and using the innovation because of social influence and communication within their networks. It can happen organically, too.
So dissemination is like putting up flyers for a party.
And diffusion is whether people actually show up because their friends are going and talking about it.
Got it. Dissemination creates awareness. Diffusion is the actual spread and adoption.
Precisely. Dissemination tries to create demand. Diffusion is the activated demand spreading.
Okay. And how does implementation science fit into all this?
Implementation science kind of picks up where simple adoption leaves off,
Yeah.
especially in organizations. It asks, okay, it got adopted, but what happens next?
Like, does it actually work in the real world?
That's a big part of it, external validity. But also, in organizations, the people using the innovation often weren't the ones who chose it.
Ah, so the users might not be motivated or might even resist.
Exactly. Implementation science looks at how to actually get things used well, consistently over time, that's sustainability, and whether it achieves the intended outcomes for the end users or clients. It's much more focused on the how and the long-term embedding of the practice.
So adoption is just the starting line. Implementation, quality, and sustainability are key.
Crucial, especially for complex changes in fields like healthcare or education.
Okay, shifting slightly government policies. The sources talked about them diffusing too.
Yes, policies absolutely function as innovations that spread. Early diffusion research actually studied things like state laws spreading.
Does it follow the same S-curve?
Often, yes. There can be a long period where an issue simmers or only a few places act, and then suddenly there's a wave of adoption driven by public attention or political momentum. Think about responses to big public health crises, sometimes slow, then rapid policy shifts.
And communication tech has sped things up.
For sure, information about what other states or countries are doing travels much faster now. But interestingly, sometimes the belief that a policy is effective, or maybe just politically popular.
Can be more powerful than actual proof it works.
Sometimes, yes. Imitation is a big factor in policy. Seeing a neighboring state or a leading state adopt something can be very influential. National media attention, federal priorities, a governor's agenda, these all push policy consideration.
What about that bottom-up federalism idea?
That's where a successful local program gets noticed, maybe highlighted by the federal government, which then encourages other states to adopt it, often with funding attached. It's innovation bubbling up and then spreading back down with support.
And who are these policy entrepreneurs the sources mentioned?
They're key individuals who really champion a policy innovation. They connect different groups, frame the policy in a politically appealing way, and push it across different levels of government. They could be politicians, advocates, agency leaders, people who bridge gaps and build momentum.
Okay, let's talk about how innovations change as they spread. Fidelity, reinvention, adaptation. What do these mean?
All right, so fidelity is basically sticking to the script, implementing the innovation exactly as the developers intended, often important for effectiveness.
Keeping it pure?
Kind of. But then there's reinvention. This is when the developers change the innovation before it goes wide, maybe based on early tests, to make it easier to adopt or work better in practice.
Like the YMCA diabetes program shifting to groups.
Exactly. That was reinvention to improve reach and cost effectiveness. And then adaptation is what happens out in the field.
The people actually using it tweak it.
Yes, they modify it to fit their specific situation, their clients, their resources.
So there's a tension there, right?
Yeah.
Sticking to the model versus letting people adapt it.
Huge tension. But the sources suggest that allowing some flexibility, letting implementers adapt the non-core elements, can actually boost diffusion and long-term use.
Why is that?
People feel more ownership. It fits their context better. As long as the core, essential parts remain intact, adaptation can be really positive. Getting feedback from the field and using it to refine things is also key.
This sounds like it leads into purposive dissemination or designing for diffusion, being strategic from the start.
Exactly. It's about thinking ahead. Is this innovation actually needed? Will it reach the people who need it most? How will potential implementers view it? What support will they need?
Planning for the spread, not just creating the thing.
Right. And assessing readiness, understanding those attributes we talked about, cost, simplicity, compatibility from the implementer's perspective.
And what about using those advice networks proactively?
That's the formative assessment idea. If you can map out who influences whom in a target group.
You can focus your efforts on those key influencers.
Precisely. Get those opinion leaders on board, let them experience the benefits, and they can become powerful advocates, accelerating the spread through their networks, like that Canadian nursing home study.
Targeting the multipliers. Makes sense. And the sources emphasize getting off on the right foot.
Yeah, initial experiences matter a lot. Diffusion can be path-dependent, early stumbles can be hard to recover from, and timing is critical.
Don't launch when people are totally swamped with other things.
Exactly. You need to find the right window. And really think about the barriers. For everyone involved, the end users, the practitioners, often, especially in healthcare, you need buy-in at multiple levels, managers, clinicians, patients.
It sounds incredibly complex to manage.
It really can be. That's why looking at the whole pathway from the start and thinking about incentives, not just money, but intrinsic motivation too, is so important for reducing those barriers before you even launch.
Okay, let's try to wrap this up. Pulling it all together, what are the big takeaways from this deep dive on diffusion?
I think the main thing is that diffusion isn't simple or automatic. It's a really complex social dance. It depends heavily on the innovation itself, sure, but just as much on the people involved, their relationships, their perceptions, and the whole context they're operating in.
And it's often slower and harder than we think, even for really good ideas.
Absolutely. Understanding those dynamics, these curve, the adopter types, the importance of opinion leaders and networks, the need for adaptation, the difference between just spreading info and achieving real adoption and use, that's all crucial.
So for our listener who brought us these sources wanting those aha moments, hopefully this helps clarify why some things spread and others don't. It's not magic. There are patterns and factors we can actually understand.
Definitely. So maybe a final thought to leave everyone with. Think about an innovation you care about, something you think should be more widespread. Using these ideas, its attributes, the social network around it, the context, what could actually be done differently to help it spread further and have more impact? Where are the levers you could pull?
That's a great challenge. It forces you to apply these concepts. It really gives a much richer way to think about how change actually happens, or sometimes why it doesn't. Thanks for joining us for this deep dive.